Hello everyone. Today we are going to study about humerus. So you can see the humerus over here. Okay. Now we'll be talking furthermore. Now you can see the humerus over here. Humerus is the bone of the arm. It is longest bone of the upper limb. It has upper end, lower end, and a shaft. Okay. Now you can see over here. This is what? This is upper end. This is lower end, and this is shaft. Okay. Now we have to determine the side. So what is this? This is the upper end, this is the lower end, and this is the shaft. Okay. Now what happens? This is called, this is what? This is head of humerus. So this head of humerus is directed medially, upwards, and backwards, where the lower end is what? Lower end is expanded from side to side and flattened from before backward. Okay. So upper end is what? Upper end is medial, which is round, and the lower end is what? Lower end is expanded from side to side and flattened from before backward. Now talking about lesser tubercle. What is this? You can see over here. This is what? This is lesser tubercle. Okay, and this is what? This is bicipital groove. You can see bicipital groove. So the what happens? This the lesser tubercle project from the front of the upper end. Okay, project from the front of the upper end and is limited laterally by the intertubercular sulcus. Okay, project from the front. Okay, this is the project from the front of the upper end and is limited laterally by the intertubercular sulcus. So now let us move forward. Now let us talk about shaft of the humerus. Okay, the shaft of the humerus is somewhat triangular width. Now the shaft is divided into three borders and three surfaces. Okay, what are the three borders? Three borders are, what are they? This is anterior border. This is what? This is medial border. Sorry, this is lateral border, and this is what? This is medial border. Okay, this is anterior. This is what? This is lateral border. This is what? This is medial border. Okay. Now talking about surfaces, there are three surfaces. They are anterolateral, anteromedial, and the posterior surfaces. Now you can see what this structure is. What this structure is? Deltoid tuberosity. And you can see the over this structure. This is what? This is what? This is radial groove. Okay. Now we have to talk two neck. What are they? This is what? This is anatomical neck, and below this what happens? There is surgical neck. Okay. Now this is what? This is lesser tubercle, and this is what? This is greater tubercle, and between these two tubercle there is what? There is bicipital groove. So will be more confusing where the capitulum is, where the trochlea is. Okay. Now you can remember the mnemonic is CR, and that is what? Capitulum on radial side. So what is this? This is capitulum. Okay. And what is this? This is trochlea. Okay, this is capitulum and this is trochlea. You can see over here, this is what? This is middle epicondyle, and this is what? This is lateral epicondyle. Now with this we have compared the lower end, and so let us revise again. The condyle, what happens? The articular parts of the condyle, the capitulum and the trochlea. The capitulum what? Capitulum articulates with the radius of the forearm, and the trochlea, what this trochlea articulates with the what? Trochlea articulates with the ulna of the forearm. Okay. Now the two epicondyles. Okay, this is middle epicondyle, this is what? Lateral epicondyle. The lateral epicondyle is what? Less pronounced than the middle epicondyle. Okay, this is what? This is more pronounced. This is large bony protuberance. It is also palpable landmark on the medial side of the elbow. Okay, now we will be comparing about three fossa. Okay, how many fossa? Three fossa. What are the fossa? They are what? They are radial fossa. Another one is coronary fossa. Another one is olecranon fossa. Okay, we'll be talking about three fossa. What are they? They are radial fossa, coronary fossa, and the olecranon fossa. So what are the three fossa? They are a radial fossa. Where will be the radial fossa? This will be the radial fossa. Okay, this will be radial fossa. This will be what? This will be coronary fossa. Okay, this will be what? This will be coronary fossa. The remaining one is what? The remaining one is olecranon fossa. What is that? That is olecranon fossa. Where should it be? It should be backward. Okay, let us move backward. Posterior aspect. What happens? You can see over here. This is what? This is olecranon fossa. Okay, now we have talked about three fossa. With this we have covered the part. Now let us pin every structure. Okay, now let us pin every structure. Now we'll be revising this structure. What is this? This is head of humerus. This is what? This is clinohumeral joint. That makes clinohumeral joint. Okay, this is what? This is anatomical neck. This is what? This is surgical neck. This is This is lesser tubercle. This is what? This is crest of lesser tubercle. Okay, this is what? Crest of greater tubercle. Okay, now we have to remember muscle insertion over here. Okay, what are this? There is muscle insertion over here. So this is what there is. This is medial leaf and this is lateral leaf, which means what? There will be muscle insertion. Okay, so there is minor or major. There is major. There is major will be inserted over here. Okay, there is major will be inserted over medial leaf. Where will be the pectoralis major? Pectoralis major will be inserted over here. Okay, on the lateral leaf. And what happens in between these two leaves? There is bicipital group. On the bicipital group, what happens? There will be insertion of what? There will be insertion of the latiss between two fingers. That is what? Latissimus dorsi. Okay, there will be insertion of what? Latissimus dorsi. So this is what? This is pectoralis major. Okay, now we have compared about this structure. Now what we can see over here? This is what? This is what? This structure over here is what I mean. This structure is greater tubercle. So what get originate over? What get inserted over here? Okay, so what are the three muscles inserted over here? What are they? They are rotator cuff muscles. So let us remember with seats. Okay, what are they? Seats. So this seats subscapularis will be inserted over lesser tubercle. All seat will be inserted over this tubercle, which means what? This is supraspinatus, infraspinatus, and teres minor. Okay, so what are the muscles that get inserted over greater tubercle? They are seat. They are supraspinatus, infraspinatus, and teres minor. On the lesser tubercle, what muscles get inserted? They are not. It is what? Okay, on greater tubercle, they will be supraspinatus, infraspinatus, and teres minor will be get inserted. On the lesser tubercle, what happens? There will be insertion of the subscapularis. Okay, with these things, now let us talk more about this structure. We have already seen about what happens. We have already mentioned. We have already seen about this structure. This is what? This is what? This is here of humerus. This is what? Surgical neck. This is what? Anatomical neck. This is lateral leaf. This is medial leaf. This is lateral leaf. And this is what? This is what? This is deltoid tuberosity. This is what? This is anterolateral surfaces. This is what? Anterior medial surfaces. Okay, we have anterior lateral surfaces and anterior medial surfaces. What is this? This is medial supracondylaris, and this is what? This is medial epicondyle, and this is what we have already mentioned, coronal fossa. This is what? This is trochlea. This is humeroulnar joint, which makes humeroulnar joint. Okay, this is what we have already mentioned, CR. This is capitulum. This is what? Humororadial joint. Okay, and there is, so we haven't seen there, so this is the 3D view. Okay, so we'll be showing in next figure. Okay, so this is what? This is radial fossa. This is what? This is lateral supracondylaris. This is what? This is deltoid tuberosity, and this is what? This is anterolateral surfaces. So we have read this is radial group. With this, I have already mentioned all the structure that is present on the in the humerus. Okay, now we'll be talking further more about the anterior compartment muscles of the humerus and the posterior compartment muscle of the humerus. Okay, what are the posterior compartments? The posterior compartment muscles, there is only one muscle. What is that? That is tricep. So tricep has how many here? Tricep has 3 here. Okay, tricep has how many here? Tricep has 3 here. What are they? They are what? They are long head, medial head, and lateral head. Okay, where lateral long head arises? Long head arises from infraclinate tubercle of the scapula, and medial head arises from the posterior surface of the what? Humerus, and the lateral hair arises from the posterior surface of humerus. Okay, medial hair and lateral hair arises from the posterior surface of humerus. Where it gets insertion? It gets insertion in the olecranon force, olecranon process. Okay, now innervation is radial nerve. And now next let us talk about the 3 muscle that is present on the anterior compartment of the muscle. What are they? They are coracobrachialis. Brachialis. So the name itself suggests where it get originated. It get originated from the coracoid process of the scapula and get insertion on the medial shaft of humerus on the medial side. Okay, where medial shaft of the humerus on the medial shaft of the humerus. Okay, that is coracobrachialis. In the bicep brachii has 2 hair, lateral long hair and the short hair. Long hair arises from the supraclinoid tubercle. What I means, bicep brachii has what I means 2 hair. It get what? It get originated from 2 structure, long head and short head. Long head originated from supraclinoid tubercle of the scapula, and short head originated from the apex of coracoid process. So where did it get insertion? It gets insertion on the radial tuberosity. Okay, and now last is brachialis. So origin is from anterior aspect of the humerus. Okay, anterior aspect of the humerus. We have already talked about medial and lateral surfaces. Okay, so from this brachialis will be originated and insertion on the tuberosity of the ulna. Okay, and with this structure we have talked about all the muscles that is present on the end. So let us revise this structure showing the figure. Now you can see over here. Okay, now this is what? This is ulna, this is what radial. Okay, now this is what radio humeral joint. This is what, this is radio ulna humeral joint. Okay, humero-ulnar joint, humero-radial joint. Okay, now we have already mentioned about these things. Now you can see over here, this is what, this is clinoid cavity. Okay, you can see over here, this is what clinoid cavity. Clinoid cavity means this is what, head of humerus. Okay, it's articulate with this structure. And what happens, this is already, we have already talked about this thing. This is what, this is what, this is clavicle. Okay, and now we have already talked about this structure, and we have already mentioned this structure. You can see from the posterior aspect as well. So with this 3D view, now we have completed this structure. Now let us summarize this. Now you can see over here, what is this, what is this, this muscle is bicep brachii. Okay, what is this, this is deltoid. And what is this, this is tricep. There are three here, there are long head, lateral head, and what, long head, lateral head, medial head. Okay, and you can see over here, what is this, this is teres major, this is what, teres minor, this is what, this is infraspinatus, this is what, supraspinatus, this is what, this is deltoid, and this is what, this is what, this is coracobrachialis. Okay, so we have already mentioned about this structure. Now let us look in this review. I think we have already talked about this structure, understand about this structure. So with this I have completed my video. If I have left anything, you can comment, and now I will be coming back with radius and ulna.